Kristen, and welcome everybody. Today I'm actually going to be with you for two panels. So we'd like to make this fun and interesting. The first one, of course, is about investors. So I went from an entrepreneur to an investor recently, raising our own fund with my partner, Ted Driscoll. Our focus is AI and data with the intersection of that and diagnostics and targeted therapeutics. And so we welcome anyone to come speak with us that has an interest in that area. So I have the pleasure and honor of introducing two very interesting and experienced guests. First, I'm going to introduce Zachary Pohl, and second will be DeGheest. So Zachary, let's start with Zachary. He is the healthcare corporate development lead at Plug and Play. We all know Plug and Play puts on some wonderful competitions for entrepreneurs. I've gone many times. And fun fact about Zach, let's see. He is a fan of Bachelor in Paradise. Welcome, Zach Pohl.
Bachelor in Paradise, great show. It's a lot of fun. So yes, my name is Zachary Pohl. I'm head of healthcare corporate relations for Plug and Play Health, and pretty sure this is the clicker, right? So a little bit about me. Right after I graduated from undergraduate, I actually I started a healthcare company on my own, raised some VSee money in Dallas, went there. After that, I worked on the new ventures team at Salesforce and Groupon while doing an executive education program at the University of Cambridge. And then I decided to start volunteering my weekends, doing some clinical research at the University of Chicago Medical Center. And I really wanted to be able to interact more with patients. And so from there, I ended up becoming a graduate student at the University of Pennsylvania. It's a small school in Philadelphia, while doing some clinical research at the Children's Hospital of Philadelphia. From there, I really wanted to get more to the business side of healthcare because that's where the biggest needs are. And so I decided to join Plug and Play. Just to kind of give some background on Plug and Play, because I don't know if everybody here knows who Plug and Play is. We are the most active venture capital firm in the world. We're the most active venture capital firm in the world, made a little bit more than 1,100 investments, 8 unicorns, including Dropbox, PayPal, and on the healthcare side, Guardant Health. On just the healthcare side, we're the third most active VC firm in the world. We've now made 50 investments, 1 unicorn, again, that's Guardant Health. We were part of the first 200K there. Last time I checked, their market cap, they were about $1.8 billion. So I want to start here with a short story. Sorry, want everybody to participate just a little bit. Who here knows what this is, right? Exactly, that's what I thought. When I practiced this speech in front of a bunch of 19 and 20-year-olds, did not see as many hands go up. But here's the next question. Who here, does this spark joy for anyone? Right? No, it doesn't. I personally get pretty frustrated and a little scared whenever I see it, but I put it up here for an important reason. So I was volunteering in an ER, and this infant comes in, and infant was sexually assaulted, and because the nature of the assault was now at risk for getting permanent HIV infection. And so, patient comes in, social worker who I'm right next to gets on the phone to talk to the provider or talk to the payer to get the authorization. It's a Friday morning. We need to get it by 4 o'clock that day, or else we weren't going to be able to provide the medication until Monday, and therefore the risk of actually developing HIV for life was going to drastically increase. So, pretty high stress situation. And we're pleading, can you please get the authorization? And this was a major insurer, and they couldn't do it through an email. And we're pleading, please call me, text me, whatever you can. Please allow me to get this authorization as quickly as possible, and they couldn't do it. The only way they could was through the fax. And it's a lose for everybody. For the payer, they have to go through multiple authorization processes, find somebody who knows how to use a fax, actually give the fax, and then it takes a lot more time to actually create it. From the hospital side, you have to be able to coordinate who knows which fax it's going to do, since she was going off of her shift, who now is going to take that off, who's going to do the handoff, how are they going to get it to the right physician. So it's a lose-lose for them. And then you'll notice what I didn't mention, it's horrible for the patient, right? The patient, this infant, is getting more seriously at risk for having to live their entire life with HIV. And that's the ultimate loss. And unfortunately, they have zero say in whether we actually can start using just an email in order to get the authorization. So it's classic game theory. Unfortunately, everybody is acting in their best interest when they're working in their own silos. But overall, we can see through this very short story and why I hate this, it very much actually creates a lose-lose situation for everybody. So one thing that's really unique about me is I get the very unique insights to be able to really learn what our corporate partners are looking at. And you're going to see the 19 that I talk to on a regular basis up here. And they're some of the biggest names in healthcare. I get to talk to their innovation teams all the time. You'll see the Cleveland Clinic, Novartis, Roche, Sanofi, Bayer, AstraZeneca, U.S. Department of Health and Human Services just came on a couple weeks ago. And there's really 5 trends that I wanted to really talk about here, which are really relevant for this conference. So you're going to see them here. These are what our corporate partners are saying. This is where we want to really run to. So I want to give some numbers right here when we're talking about these. So patient adherence, number 1. There's 2/3 of the U.S. Population has some kind of chronic illness, and 147 million are not adhering to their prescriptions as they should be. That costs the U.S. alone $300 billion annually, $647 billion across the globe. When it comes to just patients being able to make their appointments, it costs us $150 billion around the globe, $30 billion within the U.S. And these are huge costs that are taking up our healthcare system. That's why it's roughly 17.5% of U.S. GDP. And so when it comes to these focus areas, they're running at them. There's 2 really important points I want to point out here about trends that we're seeing in healthcare. Number 1, these things should not be done in the hospital walls, period. For anybody who's a fan of Clayton Christensen like me, an innovator's prescription goes really in depth into this, which I won't do here. But pretty much what we're looking at is when you're combining both the solution shop with the value-added care shop, it makes pricing models that make no sense, especially when it comes to these things. And when you're looking at siloed institutions like the Cleveland Clinic and the Mayo are currently trying to transition themselves to, and National Jewish in Utah, we're seeing pricing structures that are 1/5 of what they need to be or what they currently are in the market, but the actual quality of the care is just as good, if not higher. So we can do all of these things digitally at a fraction of the cost and still have even higher outcomes than what we're seeing. The second is, and this is the really interesting one, our pharmaceutical partners and pharmaceutical partners in general, every single innovation team that I talk to, they are racing to not just be any more present from creating the drug to just getting it prescribed by the physician. They're racing to be present throughout the entire patient journey. And that's a really important point. They are using digital tools, including sensors and wearables, in order to be present throughout the patient journey, so that they can make sure that the patients are taking them, to make sure there's no adverse effects, and to make sure that it's actually improving what the patient is using the drug for. So I talked a little bit about this, and one really important point is we have classic game theory happening right now. Everybody's acting in their own best interest. They're doing a really fantastic job. That's why it costs us 17.5% of U.S. GDP. But it's horrible for the patients, and we end up with lose-lose-lose scenarios. So at least what I'm trying to do is, our founder was an early investor in Dropbox, PayPal, Google. What we're trying to do is just, since we have 360 corporate partners who use us as a platform to drive innovation, bring all of them together, figure out the technological requirements that are needed for each person within that patient journey, and then put technologies in there that are going to reduce the friction points so that we can actually work as one across the patient journey. And we're fortunate enough to have the former CEO of the Cleveland Clinic, Toby Cosgrove, join our board. So one actionable thing that I think everybody can come here for, and from 2 different perspectives. The first is if you're a startup. So a lot of startups come to us. We have about 15,000 on our network, 2,000 just in healthcare. And one thing that I always tell them is don't focus on getting funding first. Focus on finding a corporate partner to do some kind of pilot with first. It makes everything easier when it comes to finding product market fit, when it comes to actually getting KPIs that are really important, and then also getting funding. So don't focus on funding first. focus on finding a corporate partner. The second is, let's say you are at a large institution. There's really two trends that we've seen which are really important to actually making innovation work. It's not just enough to find technologies that can really help you. Integration itself is actually huge. When you're a company that's over $1 billion in annual revenue, the biggest cost isn't financial, it's time, right? So two things that are really important. The first is find a champion. Find somebody who's dedicated in your company and has a very clear, simple KPI to track the success. I was talking in a private forum with the head of Visa Ventures last week, and the only thing that he does to measure whether it's a good strategic investment is just transaction volume. That's it. So you can keep it extremely simple. The second is executive buy-in. Because the biggest cost is time, you need to have buy-in from the top down in order to make sure that the investment is actually going to be worth it from a cost perspective. So again, my name is Zachary Pohl. I lead corporate relations for us. We're the third most active healthcare venture capital firm in the world. Whether you're looking for investment, you're looking to partner with large healthcare institutions, or you actually want to get involved from the corporate side in working with startups and innovation, please come talk to me. There's my email. Email me. Thank you.
Thank you, Zachary. We'll do a couple questions afterwards with both of our speakers. I have the pleasure of introducing Anne DeGheest next. She is the founder and managing director of HealthTech Capital. She has an incredibly deep domain expertise here. So when we get to the question period, I invite you to ask her the toughest questions. Here we go. Thank you, Anne.
Thank you. I'm going to use my drawings to nurture your right brain as I'm going to challenge your left brain with my words. So this should be a way to wake you up. So releasing your inner dragon, in your terms, it means how do I build a successful business model? 98% of the company who fail in this space is not because of the technology, it's because the business model did not work or did not scale up. My name is Anne DeGheest. I've been a pioneer in this space for 35 years. I coined the word HealthTech 35 years ago. Some of you may not have been born yet. Yes. And I've had like 9 IPOs and $15 billion in market cap. So I basically beat plug and play, just for the fun of it. 9 years ago, I started HealthTech Capital, and it's an ecosystem of accredited investors and strategic, which include companies like Merck, Philips, J&J. And we basically invest in the seed Series A stage. One of my investments that I personally made, I've made over 40 investments, is a company called VSee, which, if you know the space in telehealth, is really the granddaddy of telehealth. So I'm going to draw of my experience to try to imply what does it take to build a billion-dollar company in telehealth. So if you look in what happened to the tech industry, there was a transformation with mobile and data. But what it really did is to enable new business model. And as you're familiar with Uber and Airbnb, it really revolutionized the industry. Will the same thing happen to healthcare, which is semi-regulated? So who are the incumbent? The hospitals, the primary care providers, and the health plans. Who are the disruptors? Self-insured employers, they're the ultimate one paying, the tech companies, and a lot of you in the room. We all know the trends. We've been talking about this for the last 2 days. We're going to try to be more consumer-driven. We're going to try to go into chronic condition management, and we're going to try to move the care to where people live. We know that we started 9 years ago with Fitbits. It's probably my dishwasher right now, or my washing machine. But we're really moving towards digital medicine. Nobody buys technology. What they buy is a solution to a pain point. Healthcare is a service. We're really using technology-enabled services, and that's what telehealth is. And we're going to be moving very slowly to value-based care outcome. So, can the patient manage their own health? Well, this is an interesting study done in 2016 by Philips, and they asked this across the world. Guess what? There's two constituents here. 81% of Americans thought they could manage their own healthcare, but only half of their doctors thought they could. I think it's important to keep that in mind because you have to convince both parts of this equation to change behavior. What's a digital patient? Well, we know we have to collect a lot of data. It's getting commoditized. You have to put it somewhere in the body. It's not only the smartphone, but it's also smart clothes. We put it over the cloud, that's Amazon. You do some smart analytics. So what? More data doesn't do anything unless you do something about it. And healthcare is services. And this is where telehealth has a role to play, is to act upon the data that you've identified for your algorithms to get somebody to change behavior. We are not in the business of technology. We're in the business of solving a pain point. And I'm going to expand on that. So guess if you're the baby crocodile on top of it or if you're the crocodile under it. So there's two ways you can look at telehealth. It's a productivity tool for existing care. You do it faster, increase the access of care. You do it at a lower cost. You improve the patient satisfaction. You decrease the physician's burnout, and you expand the market. That's one way to look at it. Most of the talk I heard in the last 2 days were in that category. The second category is that, do you use this as a way to change the business model? Do you use this as a way to create new care models? These are the ones where you create billion-dollar companies. For example, some smaller ones is a Mayo Clinic providing global expertise, across the world in certain categories, doing emergency surgeries, across the globe. Direct-to-consumer, the second opinion we've talked about. The new category of digital therapeutics, which is huge. It's already in the billion-dollar level. Providing new way of delivering care, diagnostic and therapeutic plans that are at risk in new settings. The point I'm trying to get today is that we're focusing too much on telehealth as a technology, and there's a breadth of technologies here, from asynchronous communication, telephone, to real-time face-to-face. The AMA is thinking that 60% of primary care provider visits and ER visits are going to be replaced by telehealth. To do that, you also need companion diagnostics to get the right information, and you need to change the behavior and the workflow of the physicians. Who pays and why is the crux of the question here. Hospitals are still on their fee-for-services. Self-insured employers are driving a lot of the innovations, and only the payers who are at risk are doing innovations right now. Why is that? The key question is the time horizon. If you're trying to do cost savings and an ROI for a hospital there, the average length of stay is 4 days plus 30 days for readmission. It's really hard to do an ROI in that time frame. If you're talking a payer, they keep you on the average on the commercial side 2.5 years. Therefore, you have to do an ROI in 1 year. Again, very difficult. If you're talking to an employer, they keep you on the average 4 to 5 years. And there's also additional metrics like employee satisfaction and productivity. And then Medicare Advantage, which is really one of the early adopters, they have you for 15 years, depending on your lifespan. So it's very important when you develop your business model to say, well, what am I going to save to whom and what's the time frame? Good news, telehealth is growing at 6x, but it's not provider to provider. It's from non-hospital provider to patient. That's where the explosion is in some of these new business models. And it's typically a woman between 31 to 40 years old in an urban setting who wants convenience on what I call run-of-the-mill primary care providers issues. Telehealth is being offered in community hospitals in 76% of the cases, with up to 21% for the EICU. But if you look at the large healthcare system, which is a consolidation in the industry, it's 89%. It's there. It may not be used as much as we want, but it's happening. Now, there are a lot of challenges, and we talked a lot about in the last few days, so I'm not going to go into it. And because we're semi-regulated and it's different from state to state and all these other issues there is a lot of challenges. Now, on the employer side, look at the numbers. 90% of large employers are offering telehealth. 65% of the small employers are offering it. It's there. It's offered. Utilization is less than 10%. It's 6% if there's a copay of $30. Why is that? Because we're still talking about the patient. Consumers don't want to be defined by their diseases. They want to have fun, they want to have choice, and they want to have a lifestyle despite the fact they have a disease. So in order to do that, you need to get people to change behaviors. To change behavior is not to tell you should lose weight. You have to get the context, the behavior, the mindset. Who do you live with, who their friends are. If you look at IBM, they did an analysis of your lifetime amount of data you collect. 10% is from the EMR. 60% is all these external factors that influence your social life. Who knows you better? The doctor that you see for 6 minutes every 3 months? Or Facebook, where you spend an hour per day, or YouTube? Guess what? So what are we seeing? We're seeing employer who knows the consumer. They know how to get you to change behavior like Apple, or in this case, I'm gonna pick on Amazon, who just announced like last week, Amazon.care. And Amazon.care could be very disruptive because it's the person that pays. They're creating virtually primary care clinic where you get the best of care from 8 a.m. to 9 p.m. You can get an in-home visit with a nurse to do diagnostic and test. They'll get you the drug within 2 hours to your house. They're doing a pilot for employees in Seattle. They've created a separate subsidiary called Oasis Medical where the physicians are practicing, but it's a subsidiary of Amazon. And where do you think it's going next? We all know about Haven. You know Haven? It's 1.2 million employees. Guess what happened when they finally tuned that up after $1.2 million? It's going to be a new sector of Amazon. So what am I saying here? There's two ways you build big companies. Today is what's called current business model, fee for services, with current technologies. A lot of people have been experimenting with new business models in delivering care. And that's the Apple, where they have a clinic inside the campus. It could be Walmart. It could be One Medical. Where you start having big company build is to say, okay, I'm going to take this new telehealth technology and I'm going to change the way we deliver care in a better way. And there's the EICU, the provider, the second opinion. I'm challenging you that the real business to create big companies in that upper right quadrant, where you see digital therapeutics, which is the Livongo and Omada, where they don't focus on the technology, they focus on the problem. You have diabetes, I'm going to incorporate all of those technology to fix it, and I'm going to go at risk. I'm going to do hypertension. They're going after the pain point, happening to be using telehealth as one of the part of the solution. Then you have people like here, from Amazon, which could be extremely disruptive if they wanted to. So my question to you is that, which bucket do you belong to? And which one do you think 5 years from now is going to be the one that changed the industry? So if you look at this picture, how many of you see on the right side a kingfish that's basically feeding another little birdie? Raise your hand. Come on, come on, come on. Okay, so you're the people who are basically saying, I'm going to make the process more efficient. How many people see two people fighting for a shrimp? Okay, you're my right brain thinkers that you're not going to change the world. Thank you for listening.
As promised, Anne did not disappoint. Also, fun fact about Anne, I forgot to say this, I'm so sorry. So Anne is also an artist, as you can tell probably from her photos, right? So some detail in there. So Zach, come on over, and Anne, and we're gonna just stand here, and I'm going to ask a few questions and ask the audience to ask a few questions at all. Right now you have two of the biggest, fund investors here in healthcare. And so there's got to be some really great questions here. The first question I'm going to throw over to Zach is about the corporate investment side. You mentioned in your talk that you emphasize that entrepreneurs look for partners to be able to have some clinical validation or something like this. Can you expand a little bit on what those relationships look like for and what an entrepreneur should be looking for in that kind of relationship?
What an entrepreneur should be looking for, the easiest way to get there, the lowest hanging fruit, is just going to be some kind of pilot. So what you want to do is do some small scale pilot with a certain kind of business unit first. It's really tough to go to the actual innovation teams because they're going to look at a much broader scale. So look at an individual business unit. Try to get a small pilot happening. Typically the best person to reach out to is just the head of the business unit. From the small pilot, as long as you're going to have, as long as the KPIs are good and you worked well with the team, then you should be looking at three main further steps. The first is going to be some kind of investment from them. The second is actually going to be an acquisition. And the third is going to be a white label product. So go from a pilot with a small, with one business unit, then look at either an acquisition, further investment, or white label product. That's going to be a path that they know pretty well, and it's also just a path that has over time shown to be more successful than anything else.
Thank you. Okay, second question for Anne this time. Along those lines, Anne, you mentioned that as we saw the chart of where things are heading, and we saw Amazon and Google and Apple and a lot of those players having the most data, what kind of partnerships should startups look for you know, in terms, or what terms of exits can they potentially look for? What's their strategy? Should they look at that long-term when they start? You know, if my goal is I have a voice-enabled, you know, product and Amazon, I know, is investing in that. You know, should I be looking at Amazon as my potential acquirer? Should I involve them early? Should I wait so we don't chill any potential other, you know, bidders? Give us your thoughts on that.
In 2 minutes.
So I'll give you 3.
It's very, the good news is that the strategic are moving much earlier than I've ever seen them compared to medical devices. But you still have to be very careful that they kill you with love. And what I mean by that is that unless you have validated your value proposition with what I call a go-getter, early adopters, small, local, that you can work with, don't talk to the strategic yet because you'll talk forever. Then you have piloters, which is you do pilots forever and you never go anywhere. Kaiser will kill you multiple times with good intention. And so I think you have to really time out what are you trying to prove, what's the risk in the product, what's the risk in the market, adoption, utilization, retention, engagement, cost of acquisition. Validate those data before you talk to the strategics. What we have seen in our exits there is 2 curves. We have seen people get acquired when they get less than $1 million in revenue there. They validated, they have clinical validation because we're in healthcare. And they show that it's scalable. And then we have had Apple and the Google and all those guys buying them out under NDA. And then the VSee comes in there, and now they plug $20, $50, $100 million. Guess what? They need a $500 million exit. And then there is the valley of the desert, in which could be wiped out multiple times in the process there. And then you're trying to go public. And so having the strategic now moving much earlier because they don't want to pay the $300 million. They want to acquire talent. They don't know healthcare. So they're acquiring companies that have physicians and analytics and sensor technologies.
Thank you. Yeah, actually, in conversations I'm having with a lot of strategic investors, all the large healthcare companies, it used to be they didn't look at a startup until it was $50 million in revenue, and now they're all telling me, bring us anything. Pre-revenue, it's okay. We'll give them 50 grand. I'm like, are you serious? You're a $6 billion company, and you're okay, you know, playing with 50 grand? But I think they're all worried about losing out on the digitalization of their business.
Well, the problem that you see is that if you look at the medical device and the pharma industry, they've consolidated to, you know, half a dozen big players. And they used to be, this says, we'll wait because they have to come to us anyway, and there's an oligopoly, and you get to $50 million, we know the other players, and we'll just do a bidding war that we control. That's no longer the case, and I had this conversation with the head of J&J who says, no, have you heard about Google, Apple? This is like 5 years ago. And so that's exactly what happened. All the tech industry to say this is 18% of GDP that's being transformed. And PCP is where primary care provider is going to be the one disrupted. We all agree on that. Well, they want a piece of it. Not only do they want a piece of it on the technology side, but now you see the people like Amazon who basically want a piece on the service side. And so they're coming for the space.
Yeah, that's exactly right. Zach, one more question for you, and then I'm going to have a couple audience questions. Thank you. So when you see startups come in now, you invest in a lot of them, right? So tell me what differentiates, 1 or 2, 3 key differentiators for those that you say and they come into you and you go, yes, as opposed to those you go, not yet.
That's a great question. Yeah, so as an investor, there's 3 main things that we look for: technology, team, traction. You can kind of guess, you know, in a team, we want to be able to see that you've worked together in the past, maybe you had some exits. Actually, one big main association in terms of looking at a team, what's most successful, the one data point that actually showed a positive correlation was just, has the team worked together in a previous startup, even if it failed. When it comes to the technology, our corporate partner is saying that they want it. That's all that we do there. But what really differentiates itself from a med to a yes, how can we make introductions for you, how can we invest, is the traction that you've been able to do with the amount of funding that you had. I was in a meeting last week with a startup, very meh on it, whatever. We've heard it before, it's patient care coordination, heard it 1,000 times. And then all of a sudden he mentions with like $600K in investment that they have 30 healthcare partners already and they're doing pilots. Whoa, me and my analyst looked at each other immediately. We're like, great, next steps are X, Y, and Z. How can we introduce you to everybody? So really showing that traction and showing partners who are engaged with you, that's gonna point the needle to get us to want to be proactive instead of the startup wanting to be proactive.
Yeah, that's impressive for us as well. All right, how many startups do we have in the audience here that are potentially looking for funding? All right, okay, so I wanna hear from you. What do you wanna, give me your hands. What would you wanna, let's go over here.
Craig Zevin. I'm from UberDoc. And you mentioned the obviously productivity-oriented products and disruptive-oriented products in healthcare tech specifically. Do you see the market as any more ripe for one of those type of products over the other?
Well, there is room for both. The point I was trying to make is that it's the same amount of effort if you build a $5 million company than a $500 million company. It's the same pain of suffering, honestly. And so as an entrepreneur myself in my past, having built some of these big companies there, I want to go for the $1 billion shot, because if I miss it, it may be 500 million and I still do well. And I think the point I was trying to say in my presentation is that telehealth is an enabler for disruption. But it's not to make us better, faster, cheaper. There's going to be a lot of competition. There's no barrier of entry there. It's a commodity technology there. If you look at VSee, which basically started EICU, which I was amazed to see, like 40% of hospitals now are using it. You know, they initially started by trying to provide clinician services intensivists. And I said, that's not a business model, it's not scalable. But on the other hand, if you develop a software with your knowledge, and we put some patents there, and they went public and they were acquired by Philips for a lot of money there, that's the one, it's changing the care and changing the business model, how you get paid. That's how you make big companies. That was the point I was trying to say.
Thank you. Also, a really good point. When you're an entrepreneur and you're going to funding sources, think about what your investor needs. That's really where you're speaking to. Think about what they have to, who they're responsive to. You know, they have investors themselves, right? So if you can think backwards like that and you can address some things that are attractive to them as their own investors, that's a good model. One question over here, and then I'll do one more from the middle.
I want to talk about women entrepreneurship. My name is Siggy Marmerstein with Baby Love Advice. We are a service provider, happens to use telehealth, but that's not necessarily our goal. But I find it that it's very hard for women in general, and I want to talk to you specifically to be women entrepreneurs and be taken seriously in the VC arena. And what do you say to that?
Well, I used to joke that I have a lot of scars in my back. Now I'm joking, I have no skin in my back. But I think it's very sad that it's still 6% of the VC funding. Now the good news, if you look to the Angel Capital Association website, which is representing all the angel groups, which is around 150,000 angel investors in the space, they have a 25 to 30% of their investment are in companies that are run by women CEO, funded by women CEO. So for the earlier stage, which is to get you off the ground to prove that you can do it, the money can be get. And right now, femtech is the hottest thing. You know, it took 20 years to get from the prior cycle, and Karen will talk about it later. And so I think it's probably one of the best time. The sad part is that 6% is defined as the best time.
Thank you. Yes, we have in our portfolio right now, we have half of the companies at least are C-suite or women founders. Yes, over here.
Thank you. My question goes to both Zachary and Anne. I'm Dennis. Yes. So typically for entrepreneurs, you start by bootstrapping, trying to do it. And I think, Zachary, you rightly said you shouldn't look for funding. So my point is, how far do you bootstrap? At what point do you go and say, now it's time to look for money? I can't do it anymore. So, I mean, both Anne and Zachary, your experiences in that. How far do you go before you start thinking about investors here?
That's a great question. And there's so many factors that go into it. Unfortunately, there's not just like one like really key answer, but I think one way to actually maybe benchmark yourself is to say this: bootstrap and even raise from family and friends on a safe or convertible note in order to be able to say, here's the data that's been shown in the market. As soon as you can actually go out into the market, work with patients, whoever your population is, and actually be able to show results, and that can be at a really large organization or a small hospital, it's fine. Once you've been able to do that, that's when you can start looking for funding. I'd say that's the right inflection point for you.
So another way to look at this is that as investors, 70% of the time, if you look at the venture industry over 250,000 deals, you lose your money. We are looking for that one deal that's going to pay for all of them. It's called unicorn shopping. Now, you don't always get it, but if you get a 10 to 20x, it pays for all the one you lost your money. Therefore, when you pitch to us, we have 5 categories. We have product risk, will it work? So have something that works, even if it's not ugly duckling. Is there a market validation? Is somebody willing to pay for it? Even if it's a letter of intent, if you can do A, B, C, I'll pay for it. Number 3, what's the regulatory? Don't say, oh, we don't need to be FDA, and we all know you're going to be FDA regulated. so I have at least somebody to talk to about it. The team, there's going to be holes at the beginning, but at least get yourself some advisors that can give you some guidance that, you speak the language a little bit there. And at the end, a funding plan that makes sense. I mean, you have people there who trying to go after $50 million market, trying to raise 20 million. It's never going to work if you do the math. So our objective when you pitch to us is that you try to de-risk the first two categories, which is the most important one. Is the product working? You have some proof of that. And then you have some type of validation. There's a market willing to pay for it, and it's a large one. And why?
I would only add one more thing, and that is protection. So we had our lawyers up earlier. We look for also that there's some kind of patenting involved or some kind of competitive edge that we can monetize at to the exclusivity of others. So I'm so sorry. There's no more time for any more questions. I was told this is the